Hi, everyone. Thanks for attending my presentation. My name is Yang Pu, Director of PHOTONICS at DaVinci Applied Technology Incorporated. First, I would like to appreciate the community to give me this opportunity. My talk is about the application of photoacoustic microscope in biomedical and life science, and how our company can help the researchers and scholars in the field of biomedical optics by providing them advanced laser source, data acquisition device, and a photoacoustic image system. Our company, DaVinci Applied Technology Incorporated, is a Long Island-based high-tech company. Our mission is to develop scientific and industry laser and a novel optical-based image instrument. For laser product, we provide high energy, high repetition rate nanosecond laser for the application of photoacoustic image. We also provide ultra-fast picosecond and femtosecond laser for nonlinear optical microscopes such as two-photon and the second harmonic microscope. We also provide a solution for help the researcher to build up their unique advanced image setup for application of biomedical. For example, we provide high throughput, high sampling rate, and high ADC resolution data acquisition device and controlling system for the use of OCT, two-photon, and photoacoustic microscope. Currently, we successfully developed a low-cost extendable multi-channel data acquisition system and controlling for potential application of commercialized photoacoustic tomography and ultrasound system. The outline of my presentation will start with introduction of photoacoustic microscope pan system and how to achieve intrinsic molecular image and functional image using laser with selected wavelengths. I will then cover two topics. First, the optical resolution photoacoustic microscope or PAN system in brain glioma study, from diagnosis to therapeutic effect monitoring. Second, use the accelerated speed PAN system in ischemia reperfusion study using photoacoustic microscope, and close with the future study of extrinsic contrast enhanced photoacoustic microscope for deep tissue image and end with summary. So, what is a photoacoustic microscope? In the term of reflection mode photoacoustic microscope, a focused transducer is a key to achieve this purpose. This cartoon shows how this technology works. You fire laser on the tissue, you get a photoacoustic wave emission. Because the transducer is focused, you will achieve transverse resolution automatically. In the time of the arrival of the series, you can get depth information. That is because in your instrument for measurement, such as the oscilloscope, you can get a time train like this. This spike is a measurement of the initial pressure P0 caused by the photoacoustic effect on your target, on your molecule of your interest. Because we know the speed of sound in soft tissue very well, we simply multiply the time by the speed of sound. We can convert timing information into depth information. By scanning across the tissue, we get 2D B-scan image. If we raster scan the whole tissue surface, we get 3D image. By using optical absorption spectrum of the different molecules, photoacoustic microscope can achieve intrinsic molecular image and functional image. This is because the initial photoacoustic pressure P0 is a function of optical absorption coefficient μA and the local optical fluence FR, where the capital gamma is Grunewald parameter is a constant which can be pre-measured for different type of tissue at different conditions. It is well known that the objects absorption coefficient mu A is a product of epsilon. The molar absorption are cross-section, and C is the concentration of this molecule. Consider we have K kinds of distinct absorber of interest in the tissue. Since the measurement of the total pressure P naught is the sum of the initial pressure contributed by all the molecules. So we need K different equations to recover the concentration of each molecule according to this equation. So we can do K different time measurement of photoacoustic at different wavelengths to get the concentration of C of J for each molecule based on our pre-knowledge of molar absorption cross-section epsilon for each chromophore at different wavelengths at different lambda. It is well known that the main chromophore in the biological tissue are water, homoglobin, dehomoglobin, lipids, DNA, and melanin. Each has distinctively different absorption spectrum at the local maximum peak. So we can quantitatively image the concentration of each molecule by choosing local maximum peak of molecule of our interest, at which the absorption coefficient is sure larger than other molecules. We can image blood use a strong absorption of homoglobin and dehomoglobin in the near infrared range. This is the most powerful function of photoacoustic image. To achieve functional oxygen saturation image, which is defined as concentration of oxygen hemoglobin over a sum of oxygen hemoglobin and dehemoglobin, we at least need two wavelengths. We choose 532 nanometer and 560 nanometer for the excitation source. The reason is because the 532 nanometer is the identical point between these two absorption spectra. And hemoglobin and dehemoglobin has the biggest absorption difference in the range, in the visible range at 560 nanometer. The combination of these two wavelengths helps us to distinguish the two components clearly with less complicated algorithm. So optical resolution photoacoustic So optical resolution photoacoustic microscope was developed by Professor Li Hong Wang at Caltech. To achieve optical resolution, the key component is made up two prisms with a gap. In between the gap is filled with silicon oil liquid, which optical refractive index are matched with prism, allowing us to transmit light through this component to reach the image target. By the interface, the acoustic impedance is solid in the prism, liquid in the gap, which are high mismatched. As a result, the acoustic wave will be reflected to the transducer here. This component is much like a beam splitter, except that here involve two forms of energy, light and sound. This is so-called optical acoustic combiner. By using a laser of 80 to 120 nanojoule repetition rate of 10 kilohertz, pulse width of 10 nanoseconds, we can achieve optical resolution of 3 to 5 micron resolution at depths are up to 1 millimeter. We now apply our research project. The first one is a study on glioma tumor in mouse model. This is our brief protocol. We prepare our tumor model by injecting tumor cell into a mouse right brain, but left brain intact. So after 2 or 3 weeks, the mouse is treated with CF4P through a tail vein injection. CF4P is a FDA-approved vascular disrupting agent. Then we use our all-pan system to image the mouse brain before treatment and post-treatment by removing scalp but leaving the got intact under anesthetization. This is the result. The left image is control mice without tumor cell injection. The right one is tumor model mouse. We can easily tell the difference. The tumor core is clear display here, and there are a lot of random pattern for blood vessels surrounding the tumor. But in the normal mouse brain, no accumulated blood vessels. So we can see our OR pen system is able to distinguish normal mouse brain from the tumor mouse brain. OR pen can also be used to monitor tumor growth. These two images are taken at a different time point. Clearly, tumor at week 3 is much larger than tumor in week 2. We can also see the tumor expanded here. Besides the size difference, there is a big blood vessel here feeding to the tumor. The PA signal in day 21 is much stronger than day 15. So we can say pan system visualize the growth of glioma in vivo. So after this, we inject CF4P drug and image the post-injection mouse. So looking at two different images, pre-injection and post-injection, we can have a direct impression that a drug therapy effect in the tumor region. The PA signal strength becomes weaker for post-drug injection. This is because the drug is functioned as to shut down the blood vessel which provide oxygen hemoglobin to the tumor. Similar effect can be observed for the blood vessel around and nearby the tumor region, especially for this large blood vessel. You can see the PA signal is much weaker. So in the normal region, no obvious change can be observed. To highlight the change, we divided the post-treatment image by pre-treatment image. Here is the result. This is the actual map of individual blood vessel responded to a CF4P treatment after 1 hour. And the color bar gives us how much change of PA signal in amplitude, which reflects the blood change. We can see clear difference in blue color in tumor core and the health blood vessel in yellow, and even in red in the left side. From the color bar, we know blue means more discrete change, more yellow means fewer change. This is even exciting finding that most affected parts of this entire brain are the biggest blood vessel feeding into a tumor, which is in the bluest color. That means the big blood vessel has just approximately 20 intensity left after treatment. To quantify the change, the PA signal within the normal region and the tumor region was integrated within the blood vessel. This graph bar gives our quantitative the change for the post-treatment over pre-treatment for 6 months. We can see almost no change for normal region, but there is a big change for tumor region. So it is concluded that our PAN system is successfully applied in intrinsic contrast vesicular image to monitor the drug's therapeutic effect in label-free. To speed up the image, we use accelerated linear stage from physical instrument to develop a fast scanning photoacoustic microscope to achieve a B-scan rate of 15 Hertz for 5 mm by 5 mm image region at a resolution of 3 micron meter. This is a system. Using this system, we did our second study, functional photoacoustic image for monitoring vascular reperfusion in ischemia reperfusion in small animal model. Here is a schematic of our fast dual wavelength photoacoustic microscope for functional SO2 imaging. Two lasers at different wavelengths of 532 and 560 are combined in a dichromatic mirror into one beam. The laser is then delivered to the optical fiber into an image system. The advantage of using two lasers instead of one laser with two wavelengths is the toggle speed between wavelength switch is much faster. You use this method. The wavelength switch can be done at each A-line scanning. If we switch the wavelength at the end of the image, the total acquisition time will be doubled. Using this dual wavelength laser, the acquisition time is the same as a single wavelength image. This is a protocol to create ischemia in small animal model. In this study, we use two pieces of magnet to cap the mouse ear for 1.5 hours. Then the magnet are removed to let the reperfusion happens. During the reperfusion, the mouse body needs to keep at 37 degrees Celsius and the ear needed to keep at 35 degrees Celsius. So this video shows the blood vessel recover from the ischemia status. A pair of artery and vein reperfusion at first, but the artery is a little bit faster than the vein. This kind of intuitive observation helps us to understand the reperfusion much better than previous image tools, such, for example, for using two-photon microscope. But only vascular images are not enough. We can also have the functional oxygen saturation SO2 map of the reperfusion. So here shows the workflow of image processing to get SO2. First, we acquire PA signal using 532 nanometer and 560 excitation respectively. The image was then normalized against the laser excitation intensity map recorded by a photodiode. So the pass-to-pass energy fluctuation is compensated. Then we use a Fuji filter and a global Cherry holding to extract the vascular from the background. After we get a pure vascular image from the two wavelengths, we can calculate SO2 pixel by pixel to get the SO2 map at a different time point. This is our result. This slide shows the oxygen saturation SO2 map along different time. Now we can distinguish artery in right corner, vein in green corner clearly. In the next several minutes, I would like to mention a little bit about our ongoing project. To deep PA image in tissue, we need enhanced by contrast engine and extended laser wavelengths in the near infra. We use a tight sapphire laser, which is tunable from 700 to 900 nanometers as our excitation source. We verify our system by image USA Air Force resolution bacha under 3 millimeter chicken breast tissue. The element one of group 3 can be distinguished clearly, which means our system is approximately 60 micron resolution at 3 millimeter depth. So this is our preliminary data of near infrared pan image in mouse model at different excitation wavelengths. The vascular structure in mouse back is clearly visualized. Since our contrast changes absorption peak is ICG is located at 780 nanometer, which can be clearly displayed by our image. So we can see the image at 7-8 nanometer has a strongest PA signal here. So here is a summary. All pan system can be used to image brain glioma in vivo in small animal study, and it can be used to monitor the therapeutic effect by quantifying the relative change of the hormone group in signal for pre and post-treatment. This study will benefit tumor research and anti-drug screening. Fast scanning all pan system with dual wavelengths of 532 and 560 nanometer excitation is introduced for vascular and functional oxygen saturation image to study ischemia reperfusion in near real-time imaging. The application of extrinsic contrast enhanced spectrum pan system are demonstrated. Finally, I would like to give a quick introduction of company's product. For nanosecond laser, we have high beam quality laser for 532 nanometer and 10664 nanometer as a photoacoustic excitation source. Using self-Raman NDYO4, we can get a laser wavelength at 1176 nanometer. By using the technology of second harmonic generation, we can get 588 nanometer laser. By using some generation technology, we can get 560 nanometer lasers. So the cavity design of 562 laser is somehow similar with 532. The difference is the cutting angle and the temperature albedo crystal need to be set in a specific value to get the 562 lasing. This is a specification of 560. So this table shows the specification of our laser at different wavelengths we can provide it. From the wavelengths of 440 to 670, we have 6 different kinds of laser with high beam quality and up to 30 kilohertz repetition rate. The data acquisition device is also very important for photoacoustic image. Our new developed data acquisition device is not only a data acquisition system, but also a FPGA-based controlling device which can handle all functions for photoacoustic images such as laser and DAQ trigger and timestamp. It is a standalone DAC system independent of PC hardware and operating system. It is a 16-bit ADC resolution and dual channel for data input, 1 gig sampling per second. It provides 2 laser trigger output, 2 driver for scanning, stage motion control, and easy to integrate with LabVIEW, MATLAB, and Python. So finally, I appreciate the support from the Lab of Biomedical Optical Image at Singapore Bioimage Consortium, especially for Dr. Yen Bai and Professor Manini Olivier. I also appreciate useful discussion with Professor Li Hong at Caltech. Thanks you again for attending this presentation. In the rest of time, I'd like to answer your questions.